for this section, I want to get the first part of chapter 7, which may not be in this order in the book, I forget. But today I want to talk about the dissociative disorders and the somatoform disorders. So first term I have up here is a word that probably you're not familiar with because it's not a common word. It's iatrogenesis. And iatrogenesis is actually the manufacturing of a disorder by its treatment. And let me just put this in a kind of clinical perspective. When you have someone who comes to you for treatment, for therapy, they're generally psychologically somewhat fragile. They're needing help, or they probably wouldn't be there. There are certainly plenty of people who go to therapy because they just want to, deal with a particular problem or something like that. But for an awful lot of people, there is some kind of, of problem that drove them to therapy that they're not able to deal with on their own, and they're really struggling with it. And as a therapist, you have a position of authority. And in some cases, that authority is misused or at least misplaced in the thoughts and behaviors of your clients. And iatrogenesis is a thing that can happen where you have a client who is troubled, and as a therapist, you have certain disorders that you just find particularly appealing, and you want to put people into that particular little category of disorder. And for some disorders, it may not be particularly problematic, but for some, it could be a huge problem. And DID is definitely in that category, or dissociative identity disorder. When you're talking about dissociative identity disorder, this is a thing that is shown on TV and in movies in ways that is so incredibly unrealistic. DID is an extraordinarily rare psychological disorder, as in the vast majority of clinicians will never see a case of it in their entire career of many decades. What dissociative identity disorder is what used to be called multiple personality disorder or split personality disorder. There are reports of DID in popular culture that go back all the way to the 1800s, with Dr. Jekyll and Mr. Hyde being a popular book of many, many, many decades ago. Dissociative identity disorder, I'm just going to call it DID because it's a heck of a lot easier to say. DID is an extraordinarily rare thing that happens when a person has two or more fully formed personalities within the same person. Now, there are places in the world where this is not an unusual disorder to be diagnosed with. The North America and Great Britain, and it's just not common in the rest of the world. Even in Great Britain, it's nowhere near as common as it is in North America. Anytime you see something like that, it's worth questioning. It may be a culturally based thing. There are plenty of culture-based mental health issues, but this is one that does seem to be very tied in with popular culture. There are people, I have read a very small handful of cases that do seem to be quite genuine, but I've heard of so many cases where it absolutely just sounded like someone who was like borderline personality disorder, who had a lot of instability in their personality, and that was being taken in therapy and made into something far stronger. We all have those different hats that we wear in life. We all have different ways in which we behave in different settings according to those settings and the cultural norms and the societal norms that are expected of us in certain settings. That doesn't mean you have a different personality. this is one of those things that can get kind of messy. There are certainly people who do act wildly different from one environment to the next. However, when you're talking about giving someone a diagnosis of DID, which is such a just a huge, potentially problematic thing for someone to be labeled with, you need to be very careful as a clinician to make sure that you're not, making more problems for the client rather than less, because we're supposed to first do no harm, ideally. But the alters are the alternate personalities. So that's what the alternate to the main personality would be, discussed as your alters. Um, the way this has been shown in TV shows and movies, there's only been one really good one. There was a show on, I believe it was Showtime, but I could be wrong. It's either HBO or Showtime. Quite a long time ago. I mean, this is probably 15 years ago or older even. But there was actually a really good series starring Toni Collette that was called The United States of Terra. Now, it was on, paid cable. So if you do, find this stuff really interesting and you want to check that out, it's a very good series. But I will warn you, it is definitely PG-13 to R-rated, and mainly in the language. But there is, a bit of violence. There's some rough stuff in it as well. So just to give you a heads up on that, it's definitely not a, G-rated National Geographic Disney Channel type show for sure. But it does actually show a pretty accurate view of what having DID actually means for someone. But most of the representations you see on television and in movies is absolutely ridiculously wrong, just to the point of, oh, good grief. So the movie Split from a couple of years ago that had James McAvoy playing the main character, having DID doesn't give you superpowers. So, things like that, as far as being terribly unrealistic, definitely a pretty common thing with DID. And again, this goes back all the way to Dr. Jekyll and Mr. Hyde kind of thing. So these are hardly new ideas. It's just whenever there is a pop culture representation that gets a lot of attention, the number of cases of DID go through the roof. When I was a little girl, there was a mini series on TV called Sybil that Sally Field starred in, and all of a sudden everybody was interested in, what was then called multiple personality disorder. And yeah, just because something is in popular culture doesn't make it correct for a diagnosis. And again, the vast majority of the cases that I've seen of a DID honestly sound more like cases of someone who has borderline personality disorder and has just gone to an overzealous therapist. I have known there actually is someone who used to work in a capacity at Henderson very many years ago, who had a private counseling practice in Hot Springs, and told me that they had, over a dozen DID clients, and I was like, mm-hmm. It made me instantly look at this person with side eye for sure, because I'm just like, Hot Springs, a dozen people with DID. I mean, Hot Springs is not that big a place. Again, when you have most therapists who go an entire career seeing literally thousands of clients without having one single person with this, it just throws up a red flag. So just to be aware of that. I do truly think there are a handful of cases that are legitimate, but there's also an awful lot of room for people to name alters when they're not. I mean, does Beyonce have DID because she becomes Sasha Fierce when she's on stage? I don't think so. We all put on those hats. We all act differently in different situations, and naming that an alternate personality isn't helpful, really. And, I mean, okay, if you're a musical artist or something, that's one thing, but for your average person who's just struggling with things, it's probably not the best thing. Um, when you're talking about dissociative disorders, just in general, I actually didn't put that up there on the list. Dissociative disorders are just problems with integration of memory, consciousness. A lot of it does have to do with just your awareness of your environment. There are a lot of different things that can get confused with identity as well. Uh, People having these amnesia issues, dissociative fugue and amnesia also, are things that don't happen very often, but dissociation is a very normal thing for us to do. To just kind of lose touch with reality for a bit is perfectly fine and perfectly normal. We all daydream. Well, okay, most all of us do. You occasionally just kind of stare off into space and go bye-bye for a minute. You can have highway hypnosis where you're driving down a long, boring stretch of road and you just kind of, zone out. That's fine. It's normal. There's nothing wrong with you doing that in, at least some situations. But when you're talking about someone who's got a dissociative disorder, they're not consciously in control of the zoning out. Most of us, when we zone out, we can snap back very, very easily and very quickly. It's something that we do, when we're bored. It's something that we do in a dull environment, like again driving down a long stretch of road at night or something. I know like the stretch of highway between like around Jacksonville, other side of North Little Rock to Memphis is just a long straight dull stretch of interstate highway. I mean, not that interstates are generally all that exciting to look at anyway, but that stretch is a particularly dull stretch of highway because there's absolutely nothing to look at because it's rice fields on both sides of the highway for so much of it. So there's this long stretch where I remember several times driving that stretch and just being like, and just zoning out. And that's normal. You are driving and you're driving on the interstate and you're just cruising along and the traffic's, very, very light. And your mind wanders and all of a sudden you look up and you've driven, 30 miles and you didn't even remember that. Normal. That is normal. When you are in a dissociative state that's clinically significant, you're talking about someone who is not able to control it, who's not able to snap back easily from it into reality. A dissociative fugue, now this does not happen very much, especially now that everybody's got, a tracking device on them at all times. But when someone has a dissociative fugue, it's like a sudden and unexpected travel away from home with an inability to remember details. I mean, like the people who will just up and leave home and go start a new life somewhere else kind of thing. Again, very difficult to do that. We are all electronically tracked so much that it would be very difficult for someone to just, up, drive, like, pack, not even pack their stuff, just get in their car and drive to like Arizona and start a new life there because you've got to have identification. It's just too easy for people to track you through your car, through your phone, through your, just everything. So that's not as common, not that it was ever common, but it's certainly not as common as it used to be just because the technology is around to be able to track people far more easily than it used to be. You can follow like debit card usage and stuff like that. People aren't going to have the dissociative amnesia where they just forget who they are and not have a clue, because even if you had some kind of an accident and you suddenly had amnesia and you had retrograde amnesia where you forget who you are, if you're carrying a phone, well, most phones have some kind of identification, like I don't know what y'all have, but I mean mine has the fingerprint recognition. A lot of them have the face recognition. So you'd be able to open up a phone. If you have a phone in your pocket, open up the phone and there's your identity. at least, a heck of a lot of clues to your identity are just right there in your phone. So for, people now, this is just not going to be a real common thing to have happen. Now, depersonalization disorder is something that does still happen quite a bit. Depersonalization disorder is kind of what it sounds like. It is feeling detached from yourself. A term that I remember very clearly, the as if I'm not real, as if the world isn't real, as if I'm in a dream or a nightmare. More likely, depersonalization disorder is going to be kind of a vague unease more than the kind of nightmare kind of scenarios, but just feeling detached in a significant way from the world around you. And there are certainly people with mental health issues that do have these kinds of feelings, and they can be, very problematic, but not to the point of like having a dissociative identity disorder or having a few, kind of state. But this is something that does go along with usually when you see a depersonalization issue, there are other things going on with that individual. You may have someone who is mildly psychotic, but it's not severe enough to be diagnosable as schizophrenia or something of that nature. You could have someone who has previous substance abuse and they're coming, out of that, and they have some of these kind of depersonalization issues. There can be, depression and anxiety that can be bad enough to cause people to have some of these kind of dissociative states. But again, for it to be a disorder, you're talking about something that is happening, a lot, and happening enough to interfere with your functioning. So again, these are not, thankfully, these are not common disorders for people to have. Okay, into the somatoform disorders. Somatoform disorders have to do with your body. These are things that are messing with your ability to function, in that they are affecting your physical state as well as your mental state. Generally speaking, when you're talking about somatoform disorders, you're talking about a set of disorders that are not diagnosable as medical issues. You've got people that have physical symptoms, but there's no medical cause for them. But here's the thing, there are all sorts of ways. Your mind and your body are connected, right? Your mind and your body are, well, they're inhabiting the same, vessel. And when you're talking about people having somatoform disorders, just because there's not medical evidence for a headache doesn't mean you're not still having a headache. Just because there's no medical reason for you to have a stomach ache doesn't mean you don't have a stomach ache. There are a lot of things that are at least somewhat psychologically impacted as far as just illnesses. Our immune systems are affected by our stress levels, our certainly having a lot of tension in your body can cause you to have stress-induced headaches, and migraines are very, very much tied to people's stress levels. So these are things that are very, very common and real. The suffering is real. When you're talking about somatoform disorders, barring the few that I will tell you absolutely are not real thing, we're not real suffering involved. It's people pulling, cons kind of things. These are people who are genuinely suffering. There's a psychological component to their suffering and the cause of their suffering and the physical cause of it, but it's the physiological manifestation of psychological pain. And for some people, it's literally turns into physical pain. It turns into physical illness for these individuals. Now, when you're talking about a conversion disorder, specifically, these are generally neurological symptoms that don't have any reason to be happening. When you're talking about people who have conversion. This goes back to some of Freud's idea. It's like converting some kind of psychological problem into a physical problem. Like you would have someone who has conversion disorder blindness because maybe they witnessed some horrific crime and I can't process it yet, and they just can't see for a time, or they become paralyzed. Um, Actually, an interesting case. My daughter-in-law, who's the nurse practitioner in orthopedics at a large hospital in Dallas, had a patient recently. Again, she works in orthopedics, but there was a teenage high school age girl who came into her care who couldn't move her legs. And they did all this investigation to find out what was going on. And lo and behold, we find out that this kid, who I think she was 16, was under a tremendous amount of pressure by her parents, by coaches, about playing sports at school. And she just psychologically couldn't quit, but she could just convert that pressure that she, couldn't say no to into, okay, well, I can't move my legs. You can't make me play if I can't move. So there you go. And it was, quite the investigation to try to figure out what was going on. And they finally figured out it was, basically just a conversion disorder, because she would move her legs at times when she wasn't aware that anybody was around, but she literally could not, move normally under a lot of circumstances. It was causing a lot of problems for her just personally, in everyday life, but it was, pretty clear after a while that it was just, this kid was under so much pressure that she kind of popped under it, and it came out in that. Now, that is not a typical way that people, will manifest their stress, but it does happen. I mean, it's quite unusual, but it does happen. A somatic symptom disorder. Oh, this is one that just covers so much stuff. It is basically the broader kind of problem with psychological issues that are impairing your physical functioning. You've got to have multiple somatic complaints prior to age 30. Because let me tell you, when you get to be 40, 50 years old, your body just starts hurting and you start having issues just because you're older, and, maybe you treated your body like a temple of doom. There's all kinds of things that can happen. But when you're talking about someone who is young and presumably healthy, there have to be a whole lot of different symptoms. There can be pain symptoms as far as like joint pain, pain in limbs, headaches, those kinds of things. You can have neurological issues like, being able to control your body, having tingling in your extremities, or poor fine motor control, difficulty walking, difficulty swallowing, things like that. A lot of different things having to do with your, sex life, genital issues, pain during sex, things of that nature can also fall under somatic symptoms disorders. Cardiopulmonary symptoms, where you have things like heart palpitations, chest pain, dizziness, short of breath, things of that nature. All, the kind of things that you would see in someone who is like having a panic attack, those kinds of issues. A lot of gastrointestinal problems can fall under this as well. And again, as I mentioned, with people who have really high levels of anxiety, it's quite common for people to have, I'll just call it tummy troubles, all sorts of different ways in which those can manifest, basically with problems coming out of either end of a person. And you have to have at least 8 of those symptoms. So you do have to have a pretty big, bunch of issues before this would be, an appropriate diagnosis. But there are people who will end up doing this. It's especially going to be more common in women than in men, which is a totally culture-based thing, which I'll talk about in a moment. So we'll get into that. Hypochondriasis, or illness anxiety disorder, is what the official name of it. Hypochondriasis is no longer a word for it, but most of you have probably heard the word hypochondriac. talking about someone who thinks they're sick when they're not. Um, the new term for it is illness anxiety disorder, because that actually is a better word for it. So for once, the jargon actually makes more sense than the older word for it. But illness anxiety disorder is just the fear or the phobia of kind of, so it falls into the fear of illness as well, but it's the fear of having some kind of physical illness, a fear or belief that you've got a physical illness. And it's basically taking a symptom that is minor and blowing it out of proportion. And we're talking about a lot more serious than just the kind of fleeting health worries that we all have, and especially in the last year and a half. Holy crap. Yeah, every time you get the sniffles, it's like, oh God, I've got COVID. Things like that definitely, are going to increase the amount of illness anxiety that people have. But you're talking about people who are spending inordinate amounts of time and energy worrying about their health. Now, if you've got someone who's got some serious chronic health issues, then feeling anxious about it is, well, pretty normal and expected. But if you're talking about someone who has a headache during allergy season, and they go to the doctor convinced that they've got a brain tumor, and the doctor examines them and says that they're fine, and they, are insistent that they need a second opinion and a third opinion and a fourth opinion, and they want to get all these tests done, it can take over someone's life. The amount of time that you and money that you can spend running from doctor to doctor to doctor, trying to find out, oh, I know I'm sick. That old joke about somebody's tombstone saying, see, I told you I was sick. Unfortunately, the internet has caused a dramatic problem for doctors and therapists dealing with people who have illness anxiety disorder, because there are a lot of websites out there that have medical information on them. Some of them are excellent. Some of them, WebMD, I'm talking to you, seem like they are written specifically to scare the hell out of people and to make them think that they're dying when they've got, a hangnail. And, WebMD will tell you got finger cancer that's terminal. Information is generally good for people to have. But when you're not a trained medical clinician, professionals, person, the amount of information that you can get online can be so overwhelming and so hard to understand that it can cause people to have a tremendous amount of anxiety, because they're not able to look at something more realistically or more clinically. And especially if you're already worried that you've got a particular disorder or something, it's going to, warp your perspective on those things. And this is a considerable problem. It's a tremendous cost to people and to society in general, because you've got these folks who are going to the doctor and running up insurance bills for things that they absolutely do not need to be doing. They're taking time off of their jobs. They're taking time out of their lives to pursue medical treatment that's not necessary. There are cases where people will go have, all kinds of procedures done that are tremendously costly and invasive, and even surgeries that are unnecessary, because these folks will just insist that they've got, something that some obscure illness that they read about on the internet, and they don't. Now, that being said, we always read these stories about someone, oh, these doctors, they couldn't find out what's wrong with me. And, I finally figured it out for myself. And of course, those are the stories that get more attention. But that is not the most common scenario. Most of the time, the doctor tells you, or, multiple doctors tell you you're fine, then you're fine. You're probably fine. Most likely you're fine. But it is hard for people to, get past some of that stuff. I get that. But there are certainly some bigger problems that can go along with that. Pain disorder, when you're talking, well, the different ways in which psychological issues can manifest as pain in the body. There's a lot of different things that you can have as far as just kind of stressors in your life that can cause you to have physical discomfort. Again, stress can manifest as, muscle tension, headaches, and things like that. So it's fairly common for things like that, but it's not a terribly common thing for people to have this kind of preoccupation with pain. And pain disorder is often people who just have a really low tolerance for discomfort, and they can get hooked on pain meds, which is one of the bigger problems with it, because these are folks who just have generally kind of low tolerance for pain. Or this is something that can happen for people who have been abusing opiates or some other kind of painkiller, usually opiates. And after they get clean, their endorphin system doesn't work because they basically took it offline while they were addicted to the opiates. So you can have people having pain disorder after that kind of situation. So again, it's just something else to kind of keep in mind if you're dealing with someone who does seem to have a lot of physiological issues as well. Anytime I had a client who had complaints like this, or if they'd had a history of certain types of illnesses, I would always want to refer them to, a doctor and make sure that they've got a clean bill of health, or, at least, try to find out what's going on, because there are a lot of physiological things that can cause people a lot of psychological trouble. It's a two-way street there. So it is something to, keep in mind. And there are certainly plenty of, physical problems that can cause us a lot of pain. People can have a number of different like autoimmune disorders, or people have arthritis, certainly as you get older. So, then they hurt, they freaking hurt. And, the medication issue is oftentimes one of the bigger problems, because you can just get addicted to these painkillers pretty easily. Okay, so to get into a couple of things that absolutely are people just faking it, you've got malingering, which is pretending to have some kind of a physical illness in order to get something out of it, usually money, usually insurance money, or some other kind of settlement type money. When you're talking about malingering, you're talking about somebody who is just straight up lying about having some kind of an illness. So not really so much of a psychological disorder, other than, do you say somebody being a bald-faced liar is a psychological disorder? Somebody lying about, and I'm not talking about somebody who's, going, oh, I don't want to go to work today, so I'm going to say I'm sick. It's like, okay, you need a mental health day, honey. We all do sometimes. That's fine. But when it is something that you're doing to like deliberately get workman's comp long after you've recovered from an injury, that would be malingering. And there are certainly therapists who have to deal with clients who are doing those kinds of things, and prolonging the amount of time that they have off from work. And, there's a certain amount of it that I think most of us can look at and go, well, yeah, I kind of see why they would want to do that. But it's also, how far are you taking it? Are you milking it for an extra week or a month? There's all sorts of things that go along with that. Now, when you get into the factitious disorder, a factitious disorder is a disorder of someone wanting to assume a sick role for the attention that they get. That sick role can be a very powerful thing. Factitious disorder can really become a very powerful thing for people if they've spent their life getting out of work, or getting out of unpleasant situations, or just getting out of doing things that they don't want to do by assuming a sick role. We do not question people being sick nearly as much as we would question other reasons that someone might turn down an invitation, or a responsibility. We cut people slack when they are sick, as we should. There are people who will take that and run with it and make it kind of their main way of dealing with life and the attention that people can get. Now, at its most severe, there's a thing called Munchausen's, or Munchausen's by proxy. Munchausen's is when you deliberately make yourself sick, when you do things to yourself, like ingest poisonous substances, or deliberately try to infect a wound to get yourself sick so you can be hospitalized. That's not common at all, thankfully. And Munchausen by proxy is far worse. We're talking about generally parents, usually mothers, yeah, I know, who will do things to make their kids sick so they can get attention and sympathy. Yeah, that's pretty messed up thing to do to your kids. But there is a lot of attention that's really problematic for some folks when they're sick, and the social media being so prevalent has caused that to be even a little bit more of a problem because you can get so much attention. Oh, you poor thing. You get on Facebook and all of a sudden everybody's coming out of the woodwork. Oh, you can get a GoFundMe. How many times have you heard about a GoFundMe for somebody who's sick? And, there's a way for people to do both the, malingering and the factitious disorder. You can have factitious disorder that's relatively mild, where you're just exaggerating symptoms of things that you already have. Or you can have the people that are just straight up making things up or making themselves sick on purpose to be able to assume that sick role. You can have, people claiming to have, a history of different kind of illnesses, like I'm a cancer survivor, stuff like that. There's self-harm kind of behaviors that people can engage in, as far as trying to make themselves sick, ingesting things that are toxic. But, they'll generally be, just taking enough to make themselves sick, not enough to seriously hurt themselves. They can have taking medication that they don't need to take. Like if you have a normal blood pressure and you take blood pressure medication, you will probably pass out because you can drop your blood pressure down to low enough where you're not going to be staying conscious very easily. So there are a whole lot of different things that can be done like that. But here's one of the things that happens with the sick role. There's an awful lot of people, gender, socioeconomic status, and culture. So I just want to touch on that for a moment. In society where you are a member of a group that doesn't have a lot of power, the sick role can get you some power. It's not a great way to get power, but it is a way to get power that people do not tend to question nearly as much as other ways that you can get power. The power to say no is a really powerful thing, and it's hard to do. And I mean, I've lived in the South as a woman for a long time. And, I've never lived outside of the South. I mean, the furthest north I've lived is Conway, Arkansas. So uh, the expectations is that you're supposed to be nice and you're not supposed to say no to things when people ask you to do things. If somebody wants you to do them a favor, well, you're just supposed to do it because you're just nice and you don't want people to not think you're nice. I personally have had situations where when my kids were younger, when they were in school, I remember several situations where, I got called, in the evening and was asked to, bake 2 dozen cookies for the next day or some nonsense. And I just would say, no, I don't have time to do that. And I actually got some blowback from that. Like I somehow was being unreasonable for not following through with an unreasonable request. It's a lot easier to just go, oh, honey, I wish I could, but I have just got the worst headache right now. I've got a migraine. I wasn't even going to answer the phone. People won't question that. People won't question you for not doing something if you say you're sick. Oh, well, I hope you get to feeling better, hun. They might even bring you some soup, It's a lot easier. It's a path of less resistance to get out of stuff that you don't want to do. Because if you just, well, especially as a nice Southern woman, if you just say no, they're going to think you're a bitch. They're going to think you're being mean. They're not going to think you're a nice person. And God forbid, they don't, if everybody doesn't think you're nice, gee, does my life experience come out there a little bit? But there are certainly things like that that do impact people engaging in these kinds of behaviors. Now, that being said, just because you do this kind of stuff occasionally, because it's just easier to say that you feel bad than to get into, I don't want to. that doesn't mean you have a disorder. As I've said before, this is only an issue if it is happening on a daily or near daily basis, and for these kinds of things, I would say you could broaden it a bit more, because if you're engaging in these kinds of behaviors that are, really potentially harmful, long term to your body, that's not, you can be doing it much less often than daily or near daily and still have that be a disorder. If you're even making your child sick very, very rarely, that's extremely problematic behavior for a parent to be doing. So that is definitely something that you would want to uh, give a diagnosis, even though it may not be something that's happening frequently. If that is serious enough where you need to do something about that. If you had a client who presented with that, but generally speaking, again, these are not super common disorders, in that the behaviors are things that you will see in a lot of people, but it being severe enough to be considered a disorder is not going to be something you're going to see all that often. So that is just something that definitely factors in. Okay, so hopefully Wednesday will be normal and I will feel better. I do feel better, but I still, you can probably tell I'm a little bit horsey sounding, but hot tea does wonders. And I will see you guys on Wednesday here on Zoom as usual.